Hi, I'm Dr. Timothy Shin. Welcome to Heart, a video series created to provide important heart and vascular information to you throughout the month of February in celebration of American Heart Month. Today's feature interview is with Dr. Jonovich, an interventional cardiologist specializing in non-surgical structural heart procedures. On February 24th, during our question and answer session, we will answer any questions we receive during our Heart video series. So please leave your questions in the comments section.
Thank you, Dr. Shin, for that great introduction. Hi, I am Teresa Dark from Marketing and Communications. And as Dr. Shin stated, today I have with me Dr. Matthew Jonovich. Welcome.
Hello, thank you very much for having me.
Dr. Jonovich, will you please tell us a little bit about yourself?
Be glad to. So I am an interventional, structural, and vascular cardiologist. And what that means is I specialize in minimally invasive techniques to treat heart disease, things like blockage in heart arteries, heart valve problems, defects or other structural problems within the heart, and also blockages in leg arteries.
So right to that point, what's the difference between open heart surgery and minimally invasive heart procedures?
So it's a good question. So open heart surgery is the traditional approach to treat problems with the heart or heart disease. It involves several steps because it involves a large incision to access and visualize the heart and perform the surgery. It requires sedation, full anesthesia provided by an anesthesiologist. So that means putting a patient to sleep, placing a breathing tube, and putting them on a ventilator. The heart is exposed, and then a machine is used to remove the blood, add oxygen, and return it to the patient so it can be circulated. And that way the heart can be worked on in a non-moving state. So what we're able to do now is more minimally invasive techniques, and that means a less incision size, for example, small incisions in the wrist and the leg arteries that allow us to access the heart to complete the repair. That means we need less sedation. So instead of placing a breathing tube, we no longer have to put the patient fully to sleep on a ventilator. It also means a much quicker recovery for the patient.
So what is our Henry Ford LiveWell structural heart program, and how did we get that, and how long has it been around?
Sure. So we've had our structural heart program for going on 3 years now. And what that program involves, it's a multidisciplinary group of doctors. It has cardiac or open heart surgeons. It has interventional cardiologists like myself. It has imaging specialists and anesthesiologists. We work together to use advanced techniques to treat patients with heart disease, often with a minimally invasive approach.
So when you're doing your heart procedures and that type, so what kind of candidate is viable for these minimally invasive procedures?
This is a great question, and I'm excited to say most patients these days are a candidate for minimally invasive approaches to treat these conditions. What we know for sure is each patient and each condition is different and unique, and that means that we have a very thorough and involved process to ensure that we get the best treatment that's right and best suited for each patient. It would involve meeting with an interventional cardiologist like myself, meeting with a cardiac surgeon, and then utilizing some of our advanced imaging techniques to understand the valve or structural problem each patient is suffering, and to understand their unique anatomy so that we make sure that we select the right valve type, the right size, and are able to deliver it to them through the right approach or method to ensure their greatest success.
So you talk about type of valve and everything, and you know, a lot of people think valves as large items and what have you, but what you're talking about is something that's very small, correct? And you can send it through. How does it get to the valve that you're going to replace?
Sure. So with really revolutions in the technology, we're now able to implant heart valves through tiny incisions. We use tubes, or what we call catheters, that are inserted in places like arteries of the wrist or the top of the leg. We look from the outside in using advanced imaging techniques. So that involves X-ray and high-resolution ultrasound. So we no longer need to expose the heart to see where we're working. We can look from the outside in, and we can precisely position these valves and deploy them. They can be expanded from a very small size to a very substantial footprint, almost in the way the Hubble telescope was expanded in space.
So we here at Allegiance have a hybrid OR. What is that used for?
So the hybrid OR is our newest operating room. It's a really state-of-the-art facility. It has several features. Unique features include its imaging capabilities. So it has an X-ray camera that allows us to look inside to do these procedures. It has ultrasound capabilities. It also has all the traditional offerings of an operating room as far as anesthetic, perfusion, and an operating table. So it means we can use it in a variety of ways. One is certainly these newer, more minimally invasive structural heart techniques. Sometimes we perform hybrid type techniques, which means simply part of the operation is minimally invasive and part of it is traditional or open, or we could do the traditional open approach. So in a single space, we're able to offer all of those options to a patient to ensure they get the best and safest treatment available.
So after somebody's had these minimally invasive procedures, what is the recovery time from that? And I know it depends basically on the person's health and what have you, but kind of what is the range that the viewers might be able to look forward to get back to normal health?
Sure, it's one of the marked advantages of these newer techniques. Traditional heart surgery would often require a week in the hospital and in several weeks, 4 to 6 for full recovery, and that having to do a lot with the size of the incision required and the pain and recovery from that. Using tiny incisions in the arteries in the wrist and groin, it means there's a lot less pain after surgery. So our typical length of stay would be a single overnight in the hospital and then returning home, walking out of hospital under one's own power to complete the healing process in the comfort of one's home. Generally, people are back to full activity in less than a week. And so it's a much faster recovery process for patients with less associated pain or need for other follow-up treatments.
And so back to the patients who would need this procedure, what are the indications that somebody may need to go to their primary care doctor to find out if they are having some heart issues that might require replacement or repair?
Well, these heart issues are relatively common, especially as we age. In fact, in patients over age 75, it can be as frequent as 1 in 8 people having moderate or worse valvular heart disease. Generally, it's symptoms that tell a patient there's something wrong. And those could take the flavor of things like shortness of breath, difficulty with activity, fatigue, fainting, even chest pain or pressure or discomfort. So any of those things should be a warning sign to patients that they need to see their primary care physician first, who's able to get them referred to see those who specialize in treatment of these conditions.
So what is one of the most exciting or fascinating procedures that you have done recently?
Well, there's been so many that are really exciting to talk about. One that we've recently begun to offer here at our institution is a treatment for patients who have a surgical heart valve that's beginning to wear out, degenerate, or fail to function in the way it should. We have a procedure called valve and valve TAVR, which means we're able to use these minimally invasive techniques to insert a valve through a tube in the leg artery, position it and deploy it inside of a failing surgical valve. This spares a patient a second major open operation that's of much higher risk than the first one was, and it fixes the valve problem from which they're suffering, removing their symptoms and helping them to return to full activity within a matter of days. So it's a really exciting way to fix a problem that traditionally was very challenging and frankly quite dangerous for patients.
That's really amazing. I know Allegiance has just expanded greatly in technologies, in different ways we can help our patients in our community, and we thank you, Dr. Jonovich, for coming and sitting with us today and talking and helping educate our public.
Well, thank you. It's my pleasure, and I'd certainly look forward to seeing any and all patients.
Thank you.